while waiting for others to come in, if you can just, use the chat, yeah, and use the chat to introduce yourself, yeah, just a short, just write your name and where you're from, yeah, so that we can get to know each other, yeah. So that's the limit. Sometimes that's a limitation of the online webinar, yeah. So you can't allow everybody to chat at the same time, yeah, talking in the same time. So use that chat, and then we would like everyone to network as well, yeah. So use the chat first while we wait for others to come in, then before we start the program for today, yeah. Thank you. Okay, good morning, ladies and gentlemen. We are now 10 a.m. Yeah. So I think we will start sharp, yeah, because all our moderators and speakers are all in, yeah. So
so far it come live already.
okay. Okay, so okay, greetings, yeah, ladies and gentlemen. Thank you for joining the Malaysian Association Social Workers webinar on managing stress and mental health issues, social workers' perspective today. Yeah, thank you for spending this lovely Saturday morning with us. Okay, before we start the session, allow me to do some housekeeping announcement. Yeah, so you can check your on-screen name. Yeah, to see. Okay, to ensure that you have your name spelled out correctly. Yeah, so that when you want to ask question, or you want to to raise questions, then the moderator can address you appropriately. Yeah. You can use earphone, okay, with attached microphone, so to reduce echo. Yeah, if you need to mute your microphone, okay, when you are entering, yeah, and when you are not speaking, yeah. If you are when you want to ask questions, then we will allow you to speak. But if you are listening, just mute your mic, yeah. Turn on the video tab if you're asking questions, yeah, so that people will know will be able to see you, yeah, and see who is speaking, yeah. Then, however, you know, when during the webinar, if you feel that your connection is lagging, one of the ways is to switch off your video, yeah. Okay, we will hold a Q&A session at the end of this presentation. You may type in on the chat box, okay, or click raise your hand, so the moderator will be able to see you, and then we'll ask you when the moderator asks you to speak, then you can unmute and ask the question. Yeah. And at the end, okay, before the end of the webinar, we will give you a feedback form, and we appreciate that you spend a few minutes, yeah, to complete that form. So as your valuable, your comments are greatly appreciated. Yeah. Okay. Now, so shall we begin? Yeah. Okay. So once again, yeah, distinguished guest speakers, ladies and gentlemen, on behalf of the Malaysian Association of Social Workers, MASW, I would like to welcome everyone to the MASW webinar, Managing Stress and Mental Health Issues, Social Workers Perspective. Today we will run the webinar via two platforms, namely Zoom and FB Live. Prior to this, we have received registration from over 100 participants. Yeah. However, due to the limits of participants allowed in Zoom, yeah, in the Zoom platform, so we are also running this event on FB Live, yeah, to allow to accommodate a larger audience. Yeah. Okay. So we have lined up the several, very experienced, yeah, speakers to talk about the topic today. So before I pass it to the moderator, allow me to introduce the moderator of today, Dr. Yusmarhaini Yusof. Yeah. Okay. Let me. Okay. So Dr. Yusmarhaini Yusof. Yeah. We all call her Annie. Yeah. So if you look at the chat, the participants, you see Annie Yusof. That's Dr. Yusmarhaini. Yeah. So Dr. Yusmarhaini is the senior lecturer. Okay, senior lecturer in social work. Okay, at the School of Applied Psychology, Social Work and Policy, Universiti Utara, Malaysia. She has a BA in psychology from the University of Michigan and Abel from the United States, and then also the Master of Social Work from the same university, specialized in interpersonal practice and mental health. And she obtained her PhD in social work from the University of Bristol, UK. Yeah. Her PhD study focused on therapy's attachment styles and therapeutic alliance in family therapy. Her area of expertise includes clinical social practice, yeah, including child trauma, family therapy, and also developmental disabilities and disabilities issues. Yeah, she has published quite a number of articles in Scopus and SSCI Journal, International Journal. And her latest publication, yeah, she's the author of this book, Knowing the Self, Attachment and Therapeutic Alliance for Mental Health Professionals. Yeah, this book was published last year by Macmillan International Higher Education and Red Group Press. Yeah, so you can, if you are interested, yeah, you can Google and find her book, and you can purchase the book online. Yeah. Dr. Annie can be contacted at her email, okay, usmar@um@du.my. Yeah. So without further ado, I would like to pass the presentation to our moderator of today, Dr. Yusmarhaini Yusof. Yeah, Annie, over to you.
Okay, thank you very much, Mr. Teo Aihua, for the introduction. Okay, welcome everybody again. So today, let me just run through how this webinar is going to go through today. There will be 3 speakers from PT Foundation. We have Dr. Rabiathul Badariah, and then we have Ms. Lai from Yayasan Gemilang, and then we have the MASW President, Associate Professor Dr. Suhaimi, Mohamad. How the webinar will be run through is, first, I will introduce the first speaker, And then after that, the second speaker will come on board and the third speaker, and the Q&A session will be at the very end. Okay, so without further ado, I think I'll introduce you to our first speaker. So our first speaker, Dr. Rabiathul Badariah, graduated from Boho National University in Kiev. She is currently the program manager for Second Chance. Could MASW display Dr.
Hold on.
Dr. Rabiathul Badariah? CV, please. Yeah, before I go on. Thank you. Right. As you can see, our speaker here has a vast experience, yeah. She graduated with a Doctor of Medicine, yeah, equivalent to MBBS here, from Boho National University, Kiev. She is currently the program manager for Second Chance, a program empowered by PT Foundation, where she works with people infected and affected by HIV. She has worked in the hold on. She has worked in the sexual and reproductive health and rights, SRHR, for more than 10 years. She formerly worked at Center of Excellence of Research in AIDS, University Malaya, and Federation of Reproductive Health Association Malaysia, and co-founded Rescue Initiative, which provides comprehensive sexuality education awareness and training. She is also the chairman of Education and Program Committee at Selangor and Federal Territory Family Reproductive Health Association, the first SRHR NGO in Malaysia, which was established in 1951. So I welcome you, Dr. Rabia. I think I leave it to you now. Thank you.
Hi, good morning, everybody. Okay, hi. Okay, so I'm gonna present a slide. Okay, just hold on. Can you see the slide?
Royhan. Lelaki yes. Roy.
Yeah, you can see the slide, right? Okay, so I was given a topic on how to manage stress and mental health in a social work perspective. Okay, so who are social workers? Okay, social workers are actually the bridge, okay, for the community, the people in need. Okay, so we are building the community development, we advocate for them, we are actually give family therapy, some of us actually help them in a financial aid, we help them when they have a dysfunctional family. So we are practically the bridge to the community and to the other agencies, but we are also the people who are giving ourselves selflessly. Okay, we always put others before us, and we also carry out our duty no matter what's the cost. And some of us, I do know that we spend our own pocket money to help the people in need, because sometimes they're very desperate. We can't see people actually suffering. This is a nature to us, you see, as a social workers. Okay, they're very kind. Okay, so I'm from PT Foundation. I'm a staff there. Okay, so PT Foundation is established in 1987. We are the pioneer and leading NGO in HIV field. Okay, we provide awareness, testing, treatment, support system to people infected and affected with HIV. So we've been working very closely with LGBT groups, substance abuser, sex workers, marginalized populations, including refugees and undocumented. Okay, I'm a program manager at Second Chance. Second Chance been operated since 2014, and we are program empowered by PT Foundation. We provide academic mentorship, psychosocial and social welfare assistance to family especially single mothers and children infected and affected with HIV, mainly in Klang Valley. We do have cases which is outside Klang Valley, like Kedah, Johor, Pahang, Kelantan, and so on. But we do take cases, sometimes it referred to us, okay? And we have roughly about 140 mothers and children who are active and inactive. Why they are inactive? Sometimes because the child is already 18 years old. They are inactive because for some reason, maybe the mothers feel they don't need any more help, or the children don't feel like having, or they transfer, they migrated some other places or something like that. Okay. We have about 2 full-time staff. Okay. Myself and my counselor. She's a counselor certified under the Counseling Board of Malaysia. We used to have 4 staff in the past. We had an academic coordinator and also social worker. Unfortunately, funding is always a problem. So usually we have 2 full-time, it's a must. And we have almost 35 interns in a year. So the interns could be from psychosocial interns, they could be social worker interns and academic interns. Okay, and we have roughly about 30 volunteers yearly. In our database, we have about 150 volunteers, but as volunteers are actually, they volunteer their time, so they don't have they don't have to commit the entire year to us. They usually it's just 3 months, but some volunteers, they do come back when they have free times. So some volunteers are passive volunteer, they help us from far. Okay. All right, so who are our clients? Okay, so as we are focusing a lot on mothers and children, so these mothers are mainly single mothers. Okay, and most of them, 90% of them, are survivors of domestic and sexual abuse. Okay, whether they're children or women. Quite a number of them are with disabilities, physically and mentally. Almost all of them are low income and unemployed. Okay, some of them are illiterate, they can't read and write. Okay, especially the mothers. Okay, we do have some children are not in school, and although they're 12 years old or 13 years old, they still can't read and write. Okay, especially we do have some children are we okay? All right. And with criminal records, we do have some father and mothers with criminal records because of they have been drug abusers. Okay, in Malaysia, drug abusers, they are actually been charged if they've been caught under criminal record. You see, and that's actually a causes for them why they can't get a job, proper job. And see, and yes, some mothers are ex-former sex workers. Okay, partners of drug users. So the husband, that's the reason why sometimes they are the one who get the positive HIV. Okay, a lot of them are undocumented. You can see like migrant mothers, Indonesians or Indonesian mainly, they married Malaysian, but they didn't register their marriage and children are undocumented. This is very common cases for us. Okay, some of the children are stateless. Okay, we're still fighting for doing their paperwork. PT itself actually see refugees, mainly Rohingyas, and yes, of course, LGBT is one of the core clients. Okay, so this is how our program look like. So like our program is a client-centric program. So we focus on children, and the children never come with alone. They always come with a packet, mothers, siblings, sometimes people who are living together with them. Okay, so we have to identify what are the causes that actually giving all the social issues, the issues on the children. So once we recognize the causes, that's where all the activity will come. So our work is actually to enable the environment at the same time. Okay, so beside giving mentorship, because a lot of children are fallen behind, so we need to give academic mentors. Okay, psychosocial, of course, because quite a number of them had a lot of mental health issue, depression, anxiety. We do have kids with traumatic disorders. Okay, and of course social welfare. So while we're giving this, we also have to enable this. So like a lot of them need to go to hospitals, whether it's counselings, whether psychological services, or either for HIV treatments, or maybe different diseases, you see. And we also provide sensitization workshop for our partners and so on. We give awareness talk and everything. So these clients actually have all this problem like poor employment, low education interest, they have poor mental health. The stigma is a big deal. So we have helped some clients to get a job, go to school, but somehow their the status being known as a HIV positive to the public or HR, okay, or the teachers, and they've been kicked out from work or kicked out from the school, or they've been outcasted and make them resign by themselves. Okay, this is a very big problem that we have, okay, and discrimination and documentation issues. So our work is actually to make our clients' life much more better, improve the mental health, improve the financial status, improve the resilience and confidence, and also better educations. It looked beautiful that we have a lot of things to do, but the journey to this is always the hard time, you know. It's not easy because it's involved a lot. It's a government agencies are involved, the funders, our manpowers, you know, our partners. So there's a lot of gaps in between that we have to go through. So most of our services are, we try to be holistic services. Okay, we're using MASW hierarchy approach. Okay, and I divided our challenges into two. So one is our all-time challenges that throughout the year we have the same challenges. So that in academic, quite a number of our kids are not in school because they don't have interest or they don't have money, like for transportations and so on. Some kids been drop out, and when they drop out, it's so not easy for us to put back in a school, okay? Because some schools do not want to have children with disciplinary problem, children who have attendance problems, you see. Some kids do not have motivations. They have low focus span, and quite a number of kids been bullied at school. And this bully issue been always a problem for us. Unfortunately, the school does not been cooperating to us. So our best solution that we have done is changing the school, because sometimes when we actually approach the school, we try to explain to the school that the problem is happening, but some schools tend not to, like, this is normal, nothing much. So we have quite a number of kids who actually told us that they want to stop schooling. So instead of make them stop schooling, we just change them to school. We just want the kids to finish SPM so that they can have the minimum wages, you know, after once they graduate from SPM. Under psychosocial, our challenge is our clients are having paranoid, anxiety, helplessness. They become very dependent on us. Okay, sometimes we become one-stop crisis center. Like, we focus a lot on academic, focus on psychosocial and social welfare, but we don't do all type. We do a lot of referral system, but yet the client become very dependent, and sometimes it's very difficult for us to build the resilience and empower them. And when sometimes you say no to them, that's a very hard time, and they think that we are very cunning, we are very bad people, saying no to them, and they become very angry. Suddenly they just disappear from the group, and we have to pujo them back, asking what's wrong with you. Then we have to explain why we need to say no. And it's not been an easy task for us. Sometimes we become very demotivated when the client does that. Okay, some clients can have a very poor commitment. Sometimes they demand, they want this, they wish they can have this, they requested for certain activities. When we arrange and we do something, sometimes they don't even turn up. And that's also been a very tough thing, because when you deal with the third parties, you see, and as an association, I need to keep the reputations, I need to keep a very good network with the third party. But when the client do not realize or did not commit, then my relationship with the third parties could be affected, you see. So that's another problem that I always face. Okay, trust issues and also inconsistency. The trust is because as we don't have enough manpower, we have a lot of interns. Sometimes it's so difficult for them to build rapport, because the interns are usually come for 2 months or 3 months. So rapport building can take almost even first 1 month. Okay, and it's depend. So some clients are easily build rapport. It's also depend on the intern how well they can build the rapport. So it doesn't like, it's not consistent. So sometimes we have this problem. Okay, and when it comes to welfare social work, our problem is always because they are undocumented, they have legal issue, they have citizenship issue, the location is sometimes very far, and because we have low manpower, is very difficult for us to do with this. So as a program manager, I have to teach I have to do my program, I need to do proposal writing, I need to find money, I need to get volunteers, I need to find a lot of like things, donations, like for example when COVID-19 came, we need to find sanitizer things and everything. So I have to do so much, plus I have to do social work. So sometimes it's very tiring. Okay, it's very tiring. And of course sustainability, because as we always want our client to be get empowered and they sustain themselves and sustain the program. So but it's not easy, because our program is depend 100% on the grant and public funding. Yeah, during MCO, we did have extra challenges. So because all these years, our program been face to face. So we see our client on daily basis. Either we go to the house or the client come to our house, come to our place. And on Sundays, that's where we gather the mothers and children together. And that's why the children will socialize, because quite a number of our children have problem with socializing with people. So this is how we make them hang out with everybody. And some kids are actually having fear toward adult male. So when we have volunteers of male, big size, something like that, the kids will start learning to trust them. So that's how we help them to overcome their trauma toward adult male. Okay, because they see father figure in them, you see. But when we come online, it's so difficult because a lot of our clients do not have a good internet line. They're living in like out-circuit area, okay, like Bantings, I mean, that kind of places, you see. And they don't have a smartphone. Sometimes kids are borrowing their mother's smartphone. Sometimes mothers have a counseling session and they have 3 kids in the house. Everybody have a tuition classes. So it's very difficult. Poor commitment as the school has been shut down temporarily. Kids' schedule has been haywire. Sometimes they don't want to wake up so early. So even 10 o'clock is very difficult to make them commit. And low focus span, even face to face we have problem, low focus span. So we have to allow a lot of activity to make the children very active. But through online, at the first, we just don't know how to make the kids interesting to teachers, to learn. And we have a lot of unprepared teachers. Nobody knows how to teach online. So we ourselves, we have to do a lot of training, try and errors. We need to find different approach. We have to ask our friends, so other friends, how did they do? So it's very difficult at the beginning, and it was very bad and poor we done. And the counseling also, not all our interns been trained to do phone or online counseling. So my counselor had a tough time because she had to do most of it. And during this MCO, so many of them need counseling because it happened too fast. All our clients become very stressful. And although we work from home, I don't know like when was my break time. I think the only break time I have is actually when I sleep. Because in between my whole schedule will haywire, and my counselor really like she couldn't take it until the time she feel like she become burned out because too much. Okay, and our clients are crying one corner because there's no food. Some client become anxiety and we cannot go out from our house because during MC we don't have the letter to leave the house, and we cannot even go to their place. It was very difficult. We ourselves become very helpless to our client, and sometimes we don't know that what are we doing, you see. And the domestic violence relapse when they actually stay in the same house with their abuser, like husband. Okay, and changes in psychotherapy, like we schedule certain psychotherapy but we couldn't keep with the what's it called, with the schedule. And as we supposed to receive quite number of interns during MCO, and because of MCO, university stopped giving us interns. They postponed the internship, so we didn't get enough number of interns during the time. So our manpower was very low. And as our clients are undocumented, and during the MCO we do have some problem with undocumented clients, in people as the police and everything. It was so difficult for us to reach our undocumented client. Okay, and as the location, even for food, I've been trying to get a lot of NGOs to put their name in the list for food donations, and it actually had a lot of trouble to put their name because it's so full and nobody want to reach the area. So I have to crowdfund, and then thank God we managed to crowdfund, and we couldn't do it our own. Our boss didn't allow us to leave our house. So I have to use runner that make me cost a lot. Okay, and when I use runner, I need to share their names. I need to share their phone numbers, as our duty is to keep confidentiality of our clients. So it was very conflicting, you know. So it was very difficult the moment. So during the first MCO, okay. So yes, as social worker, we've been exposed to listen our stories of client fear, pain, struggles, and suffering. Sometimes it's very tiring, and until the extent that we can have compassion fatigue. Okay, because people are putting all their trouble on us, and it's everything is here, and if we don't have a good support system, you can actually face compassion fatigue. Okay, so before that, can I know how do you guys feel today? So there's a six feelings here. Okay, joyful, I maybe this is sad, like tired, this is like angry, frustrated, hungry, cool, and also lovely. So maybe you can just say number 1, 2, 3 or something like that in the chat box, so I can see how many of you have what kind of feeling that you have. Could you actually do that? Oh, yeah, people lovely mood. I don't see number 4 here, so I figure out, oh, there's some number 4, you're hungry. Okay, right. Anybody number 3? Oh, you have a good mood actually. Okay, number 2, I don't see much. Oh, 2 and 4, okay. Hungry can make you angry, so that's normal. I have that sometime. Okay, so yeah. So are we always in a happy mood? So do you always in a happy mood? Do you? Is there any time that you actually have a low feelings? As a people working, and we might have different feelings and sometimes frustrations and so on. It is normal because we are human, especially working with another human. It's normal. Okay, so you need to know that there are some warning signs when you have compassion fatigue. Okay, so it could be under emotional, cognitive, physical, or behavior. All right. Under emotional, you can have this feeling of angry or helplessness, hopelessness. Okay, you started to don't enjoy the life. Okay, you can be irritable, you can constantly blame, I should have done better. This is what I do very often, because when things doesn't go right, I always feel like I should have done better, I should have done this, I should have done that. You know, I tend to do that very often, very, very often. Okay, and because sometimes very exhausted, I just feel very sleepy, very tired, and frequently have backache. That's very common for me when I'm too tired. And also have a pain on my shoulder. Or that's when I really know I need to take a break and I need to go for massage or something like that, because that really will make me the entire week terrible. I cannot even sit and do work. I cannot even drive. I am become very demotivated when I have this backache and so on. And my behavior, I can have reduced of work satisfactions. So this is what I will feel when I'm actually have compassion fatigue, right? So how do you manage compassion fatigue? So it's actually take care of yourself. All right, there are certain things you can do individual level or organization level. As an individual level, I try to recognize that I have a compassion fatigue. I can see differences, so I need to recognize something wrong with me. I think I'm just tired. I need to take a break, and I go for me time. I love my me time. Okay, and I also have my own counselor. So actually, my office counselor is my colleague. She is like a personal counselor. So usually when we're driving, when you do work together, when you're having lunch, sometimes we just share things. Sometimes I share things, and she usually listens. She listens. Sometimes she guide, and sometimes I already have an answer to my questions or to my things. It just I don't realize it. I just need someone to guide me, and she did a very wonderful job. In Malaysia, we rarely go for counseling. We think that only people with trouble have counseling. Counseling matters a lot. It's not about because you have a poor life or something like that. Counseling is just a person who guide to share. and we should be doing, especially social worker, counseling is very important, and the me time. You need to have your me time, especially when you're having lunch. Have 1 hour good lunch. Don't make anybody disturb you during your lunch. At least have a 10 minutes tea break, at least, and nobody disturb you on 10 minutes tea break. Have a good sleep. This is very important. I try to have a good sleep. Okay. And at the organization level, as I'm a program manager, I try to have a debriefing with my team. So I ask them what went wrong, what went right, okay, how we could do better, so that it's not about one person, but it's about the team. So we share our burdens together. We are very flexible at our office, so we give them regular breaks. They can just take it. If you think they need a break, just take a break. And peer support. The colleagues need to support each others. And we do tell our colleagues that if you need a people to talk, you need a counseling, just go ahead. And of course, professional development. None of us are perfect, and sometimes we cannot do the work correctly because we don't know how to do, and we should get a professional development to improve ourselves so that we can make things better. Okay, there are few steps for you to avoid compassion fatigue is recognizing earlier. In that way, you can actually avoid the fatigue. You can determine the causes, okay, and we can provide support to each others and take in actions. So this is not easy, okay, it's not easy, but you can ask for help from your colleague. You can ask people that, do you realize there's something wrong with me? Or colleague can tell, I think you're very stressed out, I think you need a break. So because when you work in this field, that you need to take care yourself so that you can take care others. Okay, there are few self-care type that you can do, like for example, sleep, walking. I love to take green walk. I enjoy green walk. So I have my girls drive day, so we usually drive all the way to like 3 hours drive, go somewhere far, go to green places and just walk. I enjoy, or go hiking, I enjoy that. Sleep, yes, I enjoy the most. All right. And emotionally, that I enjoy sharing it with others. And I have a baby in the house, so she's practically more like my emotional self-care, that because they're cute, funny, and I laugh, and it feels good, right? And communication and ask for help. There's something that we should do, ask for help. A lot of us think that we're superheroes. We are not superheroes, okay? We need to ask help. And you can do meditation. I do my deep breathing therapy meditation. I just on some chakra music, instrumental music in YouTube, and I take very deep breath. So like inhale and exhale very deeply, and that's actually make me feel good, especially when I'm very, very stressed up. So I do that very often. Yeah. Can have personal hobbies. Yes, you should have something that you own. Okay, like me, my personal hobbies is actually I enjoy reading. I enjoy playing ancient games like Go. I play Monopoly with my family members, you see, and I read a lot. So that's something I enjoy, and drawing. Yeah, so space is my family. I feel very safe between my family and my friends. So it make me feel good. And my room is my very, very safe space. Okay. And yeah, so you need to have good time management. Okay. It's not easy because I myself still fail to do time management. I still have poor time management, but I do try my best to have my me time. So I don't feel very exhausted. Okay. But I have a good colleague who always remind me, take a break. And my boss been very kind that he always understand our workload and he doesn't push us so much. And that make me feel I'm more responsibility to my work. Okay. So this is something that you can do for yourself, that you can create your own self-care plan. So this is, you can get this from online also. So you can actually start writing what are you doing now for your physical, psychological, emotional, spiritual, personal, and professionally. If you have a gap, you can try to think by yourself, like, what could I do? Do I have any capability to do something to fulfill this? It's okay if you don't have any. Okay, maybe I have only physical and spiritual, but you don't have others. It's okay. It doesn't have to be all of them, but you should have at least 2 of them. Okay, this is a very good exercise for your own self, okay, that you should do. And from there, you can realize that do you really care about yourself? Okay. Self-care can also be taking a step back. Okay, sometimes you need to take a step back. Okay, it's not always you going front. Okay, you can also forgive yourself. Okay, don't blame yourself. See, we are trying our best to help our client. Okay, if something went wrong, learn from the wrong thing and do it better. And we need to also say no. Saying no, it doesn't mean we are bad people. Saying no also because it could be organizational restriction, personal restrictions, that limitation that you cannot do it. So you need to say no. If not, the client will always ask you. Okay, you can set boundaries. You can ask. You can ask help. You can spend time alone and putting yourself first. Okay, this is very important that we always don't do. Okay. And self-care is not as selfish, taking care of yourself so you can have a space to care for others. This is very important. Okay. I didn't realize it after for a very long time. Then I realized that I need to love myself for me to love others. Okay. All right. So this is us in 2019. You can see how cheerful, so many activities, this is what we do. This is how our center was. This is all in our center. It's our interns and so on. And now, after first MCO, you can see even our tables has been changed. Everybody in social distancing, everybody using the SOPs, we've been getting all the donations. Our interns have extra work. They have to sanitize the place before and after all the time. And everything become online. But yet, we are actually surviving, adapting, improving, and we love our job. So that's it from me. Thank you.
Thank you so much, Dr. Rabia Bazeer, for a wonderful and insightful, especially on tips on managing yourself as a worker. I think we seldomly do that as a worker. We always focus on our client. So I think we will have, and not only that, it's also important in our job to really think of ourselves as well, and it's not selfish. So because like you said, we come first. If we can't take care of our client, we can't take care of our client best if we don't, take care of ourselves. Compassion fatigue can come in, and a lot more issues can come in. Thank you, Dr. Rabia, for sharing. So with that, I will go to our next speaker, Ms. Lai. Ms. Chan Lai, can you hear me? I think it's a bit.
Hello, yes. Yeah, I'm here.
Yes. Yeah, I think we have to off, we can't have both the phone and the video going on, or else it'll be echoing. So I appreciate everyone to probably mute yourself, as well as make sure that you don't on both the PC as well as the phone, because then we will have some echo. Okay, so let me introduce our next speaker. Our next speaker is Ms. Chan Lai Kit. Ms. Chan Lai Kit is a family champion. She graduated from Tunku Abdul Rahman University in Bachelor of Business Administration. She works for, Ms. Chan Lai Kit is a family champion from Yayasan Generasi Gemilang from 2014 to present. So as you can see, Yayasan Generasi Gemilang, they deal with a program that help adults who had lost their jobs during MCO. So she's the project manager. She also coordinates and run parenting programs. And thus, she also lead and distribute Pru Kasih, a temporary financial relief to the urban poor, coping with a sudden or unexpected loss of income. She also is a paid volunteer model to ensure that the Pru Kasih program is well implemented in the communities, as well as conducted a life skill program called Teens Live. So with that, I leave it to Ms. Chan, to go ahead with the presentation. Okay, thank you, Ms. Chan.
Hi, good morning, everyone. Thank you so much to our moderator for sharing a little bit of background of what I did and I'm still doing in Generasi Gemilang, in short, GG. I think it's such an honor and humbled to have this opportunity to share with all of you today. I think I've learned so much as well from Dr. Rabia just now. I wish I can say that, whatever that she shared, it was so comprehensive. I wish I can say all of the above, Okay, so just to give everyone a little bit of context here, obviously I am not a professionally trained social worker, and there's no licensed counselor and also psychologist in working in GG. So we don't really do any psychosocial work in GG. So if we see any symptoms in our clients, we usually refer them to licensed counselor, right? So, and today I will not be able to share anything on that level as well, all right? And however, what I can share with every one of you here is really my experience during the MCO period, how the MCO have affected and even changed the nature of our work. And of course, the stress that came with it, right? And what are some of the things that I find very useful for us to cope with those changes? Yeah. All right. I will be sharing my slides right now. Okay, I hope you can see my slides, right? Okay, yeah. So my experience in social work, my first ever experience is to run Teens Life, which is a life skill program in PPR. And after that, I was in charge of running Prukase for 4 other PPRs, like what Moderator have shared. So it's actually a temporary financial relief program for those who have coping with certain loss of income due to illnesses, due to accidents, and also death. And 2 years ago, I had the privilege to, and still do, lead this program called Fam Time. So it's a parenting program, and I run sessions as well as family camps with these families, right? So we cover topics like effective communication, ways to solve problems as a family, and also we do have a topic about managing stress as well. And bear in mind, these are all done pre-MCO, okay, and hence the picture, right? We are standing next to each other and all that. And the most recent one, I had this opportunity to really lead a small project to then refer jobs to families who were affected by the COVID-19, those who lose their job, so they can sign up with us in this program, and we refer job to them. Yeah, so I still remember in my first year working in GG, I really had the privilege to attend very good trainings conducted by MASW. And I'm really grateful for that because the team then are making sure that we have all our basic, the knowledge are covered, even though most of us are not professionally trained in this area. So I still remember the trainer at that time was Mrs. Amibala, Mr. Raymond, Elsie, and all that. So we are still very grateful for you guys, and we are still, we're so proud and so thankful for things that you do. Okay, so coming back to today, what I'm gonna share with you as well. I will move on to share a little bit about what GG does. Yayasan Generasi Gemilang, in short GG, right? So we are registered as a society in 2010. Come 2014, we incorporated as a charitable foundation called Yayasan Generasi Gemilang, and we currently have about 32 staff. And we also engage with volunteers to help run our programs, yeah. And we are governed by a board of trustees. So we are inspired by love to raise an exemplary next generation and empower families in Malaysia. And our mission, is to improve lives of underserved children and families by increasing access to quality education. So most of our programs that we run, our clients, they are from the schools, they are from institutions, they are from the B40 communities, which is the the PPRs, right? We focus our work on the B40 group, and most of our programs, we provide basic needs. We give life skill programs, we run academic-based programs, and all of this is really to make sure that the children from these families, they have access to quality education. And we do family supports as well, just like what Dr. Rabia have shared earlier. We go for a family visit. We do a background assessment, we make sure, we check what's the gap, and we make sure that they have access to education. We do have experience working with single mothers as well. A lot of them, the children are undocumented, and because they are not registered, they're not married legally, so the children are not documented, and so we have to go in and really share with them the importance of getting the children documented and getting them to school. Yeah, so these are all the programs that we have been running face-to-face. We engage a lot of volunteers as well, and the team usually needs to go on ground to run all these programs with our beneficiaries. Yeah, and so March 2020 came MCO, where the government is telling all businesses, all schools to close down. Even NGOs are not allowed to work on ground, right? So we were then so panicked. I think at that point of time, the term here, use VUCA world, I think really best describe whatever we were going through during the period, right? So every day we were, if you remember, we were watching the news, we were monitoring the number of infected patients, we were waiting for the government to announce, is there going to be another extension of MCO, right? And so we then, as an organization, we need to decide and we need to plan for business continuity, right? Our programs, we are not able to run face-to-face on ground, right? And then if we are to move everything to online, then would it still be relevant to our beneficiaries? Because our experience working with these, the B40 communities, right? Many of them, they are daily wage, right? If they don't work for that day, they don't work for that week, they have no income. And many of them struggle to save, right? And we know that even if they have any savings, it will probably not last them for more than a week, right? Then we need to, we were asking ourselves, how then do we respond to this kind of needs? We have never done any crisis response work before, right? And then we started calling our families, right? We asked them, hey, how are you coping? How's the condition in PPR? How's your children? What are you feeding your children? And we found out that a lot of families are in dire need. They are surviving on just plain rice. Sometimes they have ikan bilis and or just soy sauce. And what really breaks our heart is that we found out that there are families who are feeding children or toddlers just tea because they have not enough money to buy milk for them. So then we as an organization, we decided that, hey, we need to do something. Let's feed them. Let's make sure that in this whole MCO period, nobody goes hungry. So we decided to raise funds, and we started a project called Project SINA. So in Project SINA, we raise fund and we try to provide food aid distribution and basic needs to the families who are affected during the COVID-19. However, we have never had any experience doing all these things in such large scale, right? We have 3 communities, 3 PPR, big PPRs, and consists of 5,700 families. Then who then shall we feed with the limited resources that we have? And how do we do that? Because we are all sitting at home, right? We are not very sure whether we can go on ground to run all these programs, right? And so besides that, we also have to be accountable, to give an answer to our existing funders, right? We were funded to run all these face-to-face programs with our beneficiaries. And we also need to answer to our beneficiaries. Right now, if we are doing this new program called Project SINA, how do we then make sure that all the funds that we receive, right, with the limited resources, how do we make sure that these resources will go to the most vulnerable group in the community? How do we assess them? We used to, have the privilege of a few months to plan properly and to run our programs. And now this is urgent, right? We need to meet the need immediately, right? How do we do that, right? And lastly, even if we are going to do this project, so how do we distribute the food to the families, right? I think at that time, the government was saying that only businesses that provide essential services, if you remember that, are able to continue operating. Then we were asking ourselves, what do you mean by essential services? Are we then part of essential services as well? Yeah. So then how did we manage to cope with all these challenges, right? So number one, the first point that I would really like to share with all of you is really the posture to be able to learn, right? Continuous learning, right? Learning from the expert, even though we have never done something like this before, but it doesn't mean that it will stop us from doing at least something, from learning from the expert, from learning from others. I think one good thing that came out of COVID-19 is really we have a lot of free resources online. If you remember, there were free trainings online, and a team from GG actually went for this webinar training conducted by Lideromics, called Leading Change in a VUCA World. So when they came back and they really shared with the staff in GG this BISA framework, or called BISA framework, and we feel that actually, hey, it's actually quite useful, and maybe we can use some of this approach to run our project SINA. Right, so when there is a volatility, so we create a buffer, right? Consider what is the best and worst case scenario. Best case scenario, all the staff will be on ground and able to do the distribution ourselves. And worst case scenarios, we were thinking, okay, we will need to engage 100% of community volunteers and the leaders there, or we will need to engage a third-party delivery services so that they will send everything to the home. And of course, this will cost us a lot, right? And uncertainty, there's uncertainty, we look for ways to obtain for information. I think 1 week or 2 weeks into running Project SINA, we have a special team that will look into the urgent needs of these families. So we don't provide just food packs, right? Because some of them, they are actually telling us that I don't even have enough to feed my family today, but your food pack will arrive, you know, this Friday, which is like 3 days ahead. And some of them, they are asking us to support them in terms of medicine, in terms of adult diapers, even soap for them to shower. So we, this urgent needs team have been like ordering these products online, Lazada, Shopee, and sending it over to their house. However, we realized that it's not very effective because some of them, they are out of stock and it will take longer to reach our families, right? Then we are thinking of maybe then we can give cash aid to this family. However, we are also thinking that is it a good decision to give cash to these families, right? Will they misuse it, right? And then so we tried to do research online, and we found a report produced by it's a mouthful, the International Red Cross and Red Crescent Movement. So they did cash transfers with their beneficiaries during crisis. And according to that report, actually cash transfers are very useful in times of crisis, and also rarely have any beneficiaries will misuse those funds. So we proceeded with providing cash aid for these families so that they can then go and buy for the stuff that they need. Right? So when there is complexity, we put in structure, we cut the problem into smaller pieces. So we have 5,700 families to assess. So where do we begin, right? So we decided that we start off with one community, which is the Lembah Subang community. And we assess them based on the families referred to us by our community volunteers, right? And we started off with a few families, right? And once we get the hang of it, once we realize, hey, this actually works, then we onboard with more families. Yeah, that's how we cut it into smaller pieces, right? And lastly, when there's ambiguity, right, we need to be able to adapt, be able to learn and unlearn quickly and respond immediately. I still remember one funny incident when we were providing the food pack. We want to make sure that, hey, we need to include protein to these families. How do we do that? We give them baked beans. However, we learn very quickly that nobody likes our baked beans, and even some was asking our volunteers who called them and to just follow up on them. How do I eat baked beans? And so immediately we try to change it with something else, with eggs, with fresh chicken. Yeah. So that's my first point. And secondly, I think during the whole process of running CINAR, I think a lot of us were really asking ourselves every day, what am I doing? Because it's so new and we are not sure of what are the impacts, whether it's really helping our families. So whether we are making the right decision when we assess a family, we decided that we drop this family and we help this family. Sometimes it's really draining for us. And it is really very, very useful to then be able to reach out to someone, to have that initiative in reaching out and building a community of support. We were very privileged to have NGO friends that we can call, contacts that we can reach out to, that we call them and we ask them, hey, what are your approaches? What are your plans? What works? What didn't work? Can we share the information? And these NGO groups then form clusters, and started to share more and learn more from each other's experience. Although we are not expert in different areas, we can refer families to each other according to our expertise, right? And then, so we also managed to eliminate duplication and then ensure that our resources be able to reach out the most vulnerable groups, right? Until today, these NGO groups still meet up at least once a month to exchange updates and latest news. Right? I think COVID-19 is really the best time where we learn to lean on each other's strength. I really love the quote from Helen Keller here, alone we can do so little, but together we can do so much. So our objective, we want to make sure that nobody gets hungry, right, in time of MCO. And the outcome is that we manage to provide basic food and essential needs to these 3 main communities. We managed to provide 428 families with food aid and cash aid weekly for a total of 15 weeks, right? And also provided another 76 families with one-off food aid and cash aid. Yeah. So my third point, which I'm really passionate when I get to talk about this, because in GG we have a very good working culture, and we spend 8 hours, at work. Sometimes we meet our colleagues more than we meet our family members and our loved ones. And hence I believe that it's so important that everyone plays a role to create such a culture that, everyone can feel safe and belonged in an organization. And I'm really proud of the core values that we have, these 5 core values. It's really important to have some guiding principles for us to fall back into, in the way that we talk to others, in the way that we treat others, our colleagues, our beneficiaries, we love them, right? And then next, cultivate compassion for ourselves and compassion for our colleagues and for others, right? I think we are our worst enemies and our worst critics, like what Dr. Rabiathul shared. Right, we always say mean things to ourselves. We're not very kind to ourselves, actually. You should do this, you should achieve this, you shouldn't do that, you shouldn't make mistake. Right, we are so kind to the people that we help, to our beneficiaries, but we are not very kind to ourselves. Right, and the next, be available and present to the people surrounding us. I'm really privileged to have colleagues who will notice little things, changes in behavior. Right, they will come and ask me. In fact, recently a colleague asked me, "Hey, you have been really quiet nowadays. What happened? What are you going through?" And I really appreciate that. I have colleagues and friends who will tell me what they observe and who will then reach out to me and create that space, that safe space for me to share. And of course, always celebrate and appreciate each other. Celebrate your tiny victories, your little wins, right? It's not always that you need to achieve something big to start celebrating, and have time to, of course, to play and to be creative as well. I just want to share this slide with you. We are still playing. online, even though we are working from home. So these are my colleagues. So we are playing Among Us and other online games together, during our lunchtime, or we just find a slot after work, and then we will just come online and we play with each other, right? And we can also celebrate birthday via Zoom, right? And we share the things that we create. I think a lot of them, they learn new recipes they're trying, and we will share in our WhatsApp group, and just to encourage each other, what we have been doing at home. Okay. And so lastly, my last slide. Personally, in terms of my own approaches in coping with all this stress, I think I practice spirituality. I'm a Christian, so I believe in God. And so it is in the midst of everything that is moving so quickly, it changes so fast. I think it is really important to have to believe that there is higher being, who is still in control. I can still pray, I can still journal, and I do have my own personal support group. At the start of MCO, I meet up with these 3 girls every week. So we create that space for us to share openly, right? And it is really an outlet. Sometimes there are things that happen at work we are not able to share. So here is my own personal friends where I can share with them every week. And also creating a space to rest at home. This is my living room. And I make sure the first thing that I do during MCO is to declutter and clean and beautify this place with plants and stuff like that, so that every day after work, I will just relax myself. I will play my guitar here. I will just do some reading and just spend some time on my own. And that's it. That's all for my sharing. Thank you so much for listening.
Thank you so much, Ms. Chan from Yayasan Generasi Gemilang, for explaining to us about what Yayasan Generasi Gemilang did, as well as taking care of ourselves during COVID-19, and what you've done to families in the 3 PPR. I think it also parallel to what Dr. Rabia did with the community, as well as thinking about how best to help the community when MCO happened. Like Dr. Rabia just now was talking about confidentiality of whether, in getting things to the clients, should we use the runner? And you yourself were talking about how you experiment first by using online, and then it doesn't work out. And then what you did was going through, search online to see whether there's any evidence giving out cash. Would that work? And it does work, and it does work well. So thank you so much for your wonderful work. So with that, I think the Q&A will be at the end of the session. So I will now call on the 3rd speaker, which is the president of Malaysian Association of Social Workers, Dr. Suhaimi Mohamad. Okay, can the CV be a bit, can we make it a bit bigger? Because we can't read from there. Yeah. Okay, Associate Professor Dr. Muhammad Suhaimi Mohamad, as you see here, I think I don't, Dr. Sam, or a lot of people know him as Dr. Sam. Dr. Sam is a social work educator from Universiti Kebangsaan Malaysia. His current post at the moment is as a director at the Student for Student Affairs, UKM. He's also the president of Malaysian Association of Social Workers. In terms of education, Dr. Sam completed his PhD in social work from the University of Bristol, UK, and that's where I got to know Dr. Sam, as we shared the same supervisors. And then he did his medical social work from UKM and a BSc in biotech management from UKM as well. So he has a lot of research interests. His primary research is in schizophrenia carers. That's what his PhD is focusing about. Dr. Sam also has many more research interests that if you can, you can look here from Orang Asli's issues to social work issues to empowering the bottom 40 group, as well as developing prevention module for runaway children from home and standard measurement for researching social capital among adolescents, to name a few. So without further ado, I call upon Dr. Sam to, to share with us his experience during about stress during the MCO. Thank you.
Good morning, and thank you to the Dr. Annie, our lovely moderator. Dr. Annie actually is my colleague. Yeah, we share the same supervisor in the University of Bristol. Yeah, so I know Dr. Annie almost 10 years ago. Yeah, okay. So let me share you a slide first. Do you guys see the slides? All right. First and foremost, I want to thank Dr. Rabia and Ms. Lai for wonderful presentations, approaches, and your experience in PT Foundation and Generasi Gemilang. It's really a good process that we learn from each other, and also a good sharing so that we can have to see what others experience, maybe relate to our experience as well. All right. So in managing stress and mental health issues, I will be focusing on tips, specifically on tips to promote mental health in the work. Social welfare practitioners, so we might be overwhelmed, especially during this COVID-19 situation. All right. So now we understand here. Now we are in the third wave of this epidemic, right? So in the second wave, we thought that we already going to win to combat this pandemic somehow or rather, because of our ignorance, and that's why we have to reserve, our energy to combat for the third wave. And the third wave is become bigger and bigger. Even, the cases is alarming. So that's why the impact of this situation direct to us as social workers and welfare workers, and we will thinking how actually people living in the residential care, for all the people, for the children, for the person, and they be isolated. And when we have this like PKPD, for example, how they survive in that kind of situation, who actually have human touch to give them intervention and so on. All right. The second thing that we have to consider is about the anxiety and the paranoia. It's become overwhelmed, right? So because we are waiting, like Dr. Rabia said, when actually we can win this pandemic, and when can we back to the normal routine. But now we are in the new normal. So when it's a new normal, there will be a new case management approaches, like we use a lot of online platforms and so on. Is this what social core values and practice should be in our process of intervention? So that will be a hurdle that puts to our head, yeah? So another things that we have to see that how actually we can prohibit from embracing the loved one in the end of life. When someone is our loved, be tested positive with COVID-19, and how the funeral process be handled is very sad, but the family member is not there to have the last share, to give the last contribution to that person. So that will become very stressful and very depressing situation. All right. Another thing that you see, they have cases like in Kedah. There has a lot of cases in the prisons. Very sad, in the very compact and crowded places. There were one people affected and affect others. So this is also issue about social distancing in the crowded area. I'm sure even in the care homes also, They're very crowded sometimes. Not all care homes have a wealthy and a pleasant space. Some care homes are very packed. So how to survive? So this is what we call is we have to see that we put ourselves into this, what Dr. Rabia said, compassion fatigue. We want to give compassion to our client, but at the same time, the risk goes back to us as social workers. We actually absorb all those stress, and then how we handle those stress, and if we don't handle that stress, we have certain level of limitation of stress that we can handle, and after that, if prolonged with that, we become a mental issue. So we're going to be very worried about our health and mental health situation as well. Okay, this is what I can capture from almost like 6 months. We have been doing the MCO and so on. Most of social workers out there who have become a frontliner, they are working long hours duty. So when your client asks for help, for example, you cannot just easily ignore. You have to connect that client with the resources. So that sometimes at night you have to go out, even you don't have enough sleep. And when you are too tired, actually, you cannot have a proper or deep sleep. Is it right, Dr. Rabia? Yeah? Okay. Another issue with especially the NGOs out there where we are giving services is understaffed. We undermanned poker actually end up to do multiple roles, multiple jobs at the same time. So that's actually made us very tired, made us very, very frustrated with the certain system or policies that restrict us to go give a direct practice to our client, but we have to adapt with the new norms. I'm sure in the beginning of the MCO, we are struggling. There are a lot of restrictions for NGOs to provide aids to our clients, and we have to go through a JKM. But when we have this like advocacy and we have like a coalition with these governments restricted orders, then we can have a license from JKM that we can serve our client at the field itself, right? So all these are social worker stressor. There's a lot more that we can say here, but we can also see that we are helpless. That's what Dr. Rabia, I want to recall, because Dr. Rabia share her own experience, her own feelings. Sometimes you feel helpless. Me too. When you are being exposed to someone who are positive and you yourself have to be quarantined, and you know that your client, you have 1,000 clients under your care, need you there, and you are at home for quarantine, but you have to follow the rules and the SOP, because we want to prevent the risk to being spread to others. Okay, so this is what we call a stress threshold. If we see, let's ask us as our social workers, where are we now? Are we in the sick situation or healthy situation? If we are still active, we are still motivated, we are still focused in our job and so on, we have optimal or stress with our family life and with our work life, then we are still healthy. But if we already feel frustration, we already have fatigue, we feel exhausted, we have the kind of panic, we have anxiety. So we actually down to the what we call burnout or breakdown in ourselves. So this is the threshold. We have to identify our own indicators of mental health. Okay, you see, when the social workers is burnt out, we feel extremely tired, and the brain is overwhelmed. So this is why we need to take care and stop for a while, take a break, then we have to rearrange all these factors so that we can become our best, then we can give a quality care and provide a client satisfaction. If not, you yourself cannot focus with work, and how can you focus with others' problem or issues, right? That's very sad. Yeah, if during the MCO, if we have to distribute the food baskets and medical kits to the client, we have to wear PPE. It's very hot. You just imagine from one house to one house, you have to wear it that, and then you have to follow all the SOPs, change the glove and the keep smiling and give a good motivation, good words to others. Sometimes it's very hard. It's not easy. All right. So I'm going to wrap up some of the tips already been mentioned by Dr. Rabia. Yeah. So just I to wrap up into tips that we can use. All right. First, we have to take care our body and mind and soul as well. Okay. By taking our body, mind, and soul, we have to avoiding heart. I'm sure you guys have heard heart. Heart is hungry, you lapar, you angry, and you marah, and you lonely, you rasa sorang-sorang, no one can help you, and you are tired. That you have cannot do anymore. So that will be heart. We have to avoid that. Before we can do that, you have to have awareness. So you have to aware when you need to eat, when you need to sleep, when you need to take a time break, when you need to talk to someone, when you need to have your own me time. No one can disturb you. So that's actually awareness that you have to create. You have to be able to show to yourself, not to show to others only. All right. So awareness also is something to deal with the current situation happen outside. You have to be alert. What the changes, what's the current figures, and how to avoid that, and what is our client situation when there are changes there. So we have to make sure the awareness is there. All right. Second is about a balance. When we say balance, we cannot ignore that work-life balance is a basic rule for all social workers, all for practitioners, especially during the pandemic COVID-19, the frontliners. We have to have the balance. All right. So you have to find out your own ways how to get the balance. Someone balance themselves by having a good chat with their close friend or their best friend. Someone have time for themselves, treat themselves with a proper meal and so on, or treat themselves with online shopping and so on. But depends on your capacity. You don't follow others because some of us have more money than others. So you can have more shopping. But if you don't have money, don't just think about money to balance your life, but give maybe a visit to your family, or give a call to your family, talk to someone that you are close, that you are super happy. So that's actually make yourself balance. All right. And the third one is the C, is connections. When we say connections, cannot ignore other people. We cannot become isolate when we have stress. So we have to at least let other people close to us know where is our situation. Or what our current status. So we have to let people know, and we also have to ask others. Have to be fair. Remember that social workers, we always tell people we are listen to you. We are listen to you. But when we are listen to ourselves, so we have to make sure that when we need help, we have to admit, and we have to put our ego down, and we have to go seek the professional or indirect supports from our friends or our supports. Okay. All right. The second tip is like we are practice of physical and social distancing. Now, the case management during the COVID-19 for social workers, we still follow the step by step in a problem solving technique, but somehow they have changes. For example, like when in the intake phase, when we are trying to engage with our client, now our engaging maybe through social media, through WhatsApp, and through online and so on. But if our client in the other side don't have that facilities, don't have that access, so we have to make ourselves available to go physical visit, a home visit, and so on. But if you cannot go, then what Dr. Rabia just shared about the runners. Runners can be the part. Other runners are be trained, other runners are ready, other runners are compensated, other runners are empathized enough. So we have to make sure that already be trained or we already identify those kind of issues as well. All right. So when we say the new normal, we also need to find that how we're going to do the assessment with the client. Yeah. So the assessment, we have always said that we have doing a psychosocial assessment and spiritual assessment. So if the assessment is not face-to-face, and how we adapt with the assessments online, what kind of safe platform that actually ethical to be used, because some of the online platform like Zoom, WhatsApp, Telegram is not safe. People can actually, it's not a privacy space, you know. People can just use the certain data and people take it as open, it's not a personal. So they have one website, we call it VC. VC is actually a platform, VSEE. So it's a platform online that you can use to monitor your client, but it's a private and confidential. It's an ethical compliance. So that we can use that. So as an organization, as an NGO, we can buy that apps that we can use with our client, because only for us that we have to pay, but for our client it's free to access using the VC. All right. So another thing is actually to establish a daily routine. So we have to make sure that we can predict our life. We can, of course, we cannot know what's happened tomorrow, but at least we can predict what we want to do. We have planned. We can know how to get our plans going and how to change our plan if something change outside. So this is give us a sense of control that improve our mental health. So that's like we are plan our day activity, try to start the day with the same routine, yeah. So that we can occupy ourselves and develop a task to finish in a day. If you have children at home, put a task of homework for your children to go forward activities and so on. Yeah. So this is all what we call establish a daily routine. Okay. The third tip is about connect with others. So like when we say connect with others, so we have to checking it with peers and our colleagues, and we have to know their situation, because if we are social workers don't care for other social workers, no one will care for us. We cannot expect clients to care for us. We are there to care for clients, but who cares for social workers? So the employer have to play a role. The peer support in the organization have to play a role. So we have to make a session where the online to socializing ritual, yeah. So like using technology like WhatsApp, FaceTime, Skype, and IG and etc. Yeah, it's even 5 minutes, 10 minutes. It doesn't matter the time frame, but the important is to get together and make some smile on your face. So that will be another good things to do. All right. So another thing is we have to recognize the sign of burnout. Yeah, especially for the employers. If you see absence of the workers, of the staff, or the volunteers, and so on. So we have to not just make a judgment. Oh, okay, no discipline at all. No, it's not about that. We have to understand people. We have to listen to them. You know, get to know what actually the problem. Maybe you can figure out there are frustration, there are fatigue. We also, if we are fatigued, we cannot sleep at night. That's why insomnia can prolong. Even Datuk Sri Hisham at the newspaper admit he himself is that we call hero during this COVID-19 also have a problem with sleep. Yeah, because we are worried. And so when we are worried, of course, we're going to lose our focus, and there's a social withdrawal is there. When social withdrawal, no, yourself is like you cannot read the WhatsApp, you just ignore the WhatsApp, you silence your phone or you switch off your phone totally, and you lie in the cave. Yeah, no one can trace where you are. So actually you are social withdrawal. So admit that. Yeah, okay. And then become empathy outlet, like we have to ensure that our friends, if they are not contact us within 24 hours, we have to make a proactive action and contact them. Yeah, so this is how the family and peer support that we can give to our colleagues, right? the number 4 tips is like we show empathy and understanding toward others. Like social workers, we also need therapy. So like those our friends who are counselors, who are psychotherapists, who are psychologists, they actually can also help us. This is what we call psychological capital. It's not just about helping profession help client, but we also can utilize our helping profession friends to provide us some sort of service or therapy for us to reduce or to rejuvenate back our energy. So this is actually a good practice. Like if you can have counselors at your organization, and the counselors become your best friend and also professionals. So the counselors know how to switch the role. Yeah. So that's also important that someone listen to you. All right. Okay, we should also assume that our colleagues are too busy or not willing to spend time, because these counselors, these psychologists, or these psychotherapists, if you listen, someone need your ears, definitely we are giving the ears. Yeah. If someone need your guide, someone needs your suggestion, then you give based on your experience, your knowledge. But if you don't have, you can make a referral to someone that you may know in the field of psychotherapy or in the counseling that can help this kind of problem or the situation. All right. So remember that this is all hands on deck issues where we cannot say that we can cook everything. Yeah. So we need to depend on others as well. All right. So okay, the last one, we have to limit the information intake. This is like very important because sometimes if you don't set a boundaries, you will create more stress. Yeah, you will create overwhelm issues toward yourself. Like sometimes the switch off things, switch off duty is also important. Yeah, but of course, social workers sometimes on call 24 hours, but you are human. We are
there's
human.
about 5 more minutes for you.
All right, we almost finished. Thank you, Danny. All right, so we really have to know that the time that we need to switch off for how long, not to switch on the whole day, maybe like 1 hour when you have like your me time with your dinner, with your lunch, just 1 hour. Then after that, you switch on again. And when you are doing something that you enjoy, please stop also browsing, do a multiple things online, because it's not stopping from you. You still stop from doing work, but you actually doing another work. So it actually is not a good rest. So try to at least avoid yourself 1 to 2 hours from social media and take a proper rest and pamper yourself with whatever you enjoy and make you happy. All right. Okay, so this is actually the meantime what Dr. Rabia said lah, but she already go on detail, and I think that's be enough. Yeah. Okay, and for the last one, we have to admit that you are important and don't always put yourself at the bottom of the list. So like what we said before, love yourself first before you can love others. I think that's it, Dr. Annie. Thank you so much.
Okay, thank you so much, Dr. Suhaimi Mohamad, for the explanation on taking care of ourselves as social worker. I'm sorry I have to rush you because we need to open for Q&A.
No problem, no problem. Yep.
Okay, so all 3 speakers, I think, talk along the same line about helping our clients as well as helping ourselves. And as social workers, we need to care for ourselves in order for us to give a good care for our client, basically, to provide good care. So now I open, we have about 20 minutes before we end our session. So for Q&A session, you can either write down in chat, or you can also address all 3 speakers. Dr. Rabia we thank Dr. Rabia from PT Foundation. We also thank Ms. Chan from Yayasan Generasi Gemilang, as well as Dr. Suhaimi Mohamad from MASW. So you can either raise your hand or use the chat box. Okay, please go ahead. Welcome. We welcome any question. Thank you. Okay, maybe I should start with a question first. Okay, before we wait for other people to come on board. So I'm interested to know more about Dr. Rabia's work in terms of how during MCO you were talking about you know, client who did not have internet access, a computer or phone. So what did you do? I mean, you know, how did you manage to address this issue when we first locked down, and how you know, how did you manage to get in touch with all the clients, and you know, what kind of cases that we see rises because of this issue when they don't have access to internet or even a computer or a phone, especially for young children that you say would, a lot of them would drop out. And we also see recently in, I think in Malay Mail, or is it, it was reported, or is it the Star, that many underprivileged kids drop out from school and they didn't go back to school, even post MCO when the lockdown is lifted. So maybe if you can address this. Thank you.
Thank you. On the first MCO, we had a lot of stress because our client, they only use WhatsApp. You see, they use WhatsApp most of the time. They don't understand how to use Gmail or to do Google Meet or even to Zoom. They don't even understand, even to do online applications. We have to teach them one by one. So on that moment, we used a lot on WhatsApp, but it was so difficult because the line was very poor. It's keep cutting down, and that's why the children become very irritated. And then the timing, the schedule is really run because we also have our admin job to do, and our volunteers, we cannot, because as a confidentiality, we don't share clients' phone number to our volunteers. And even to the interns. Interns cannot have clients' number because we don't want the clients to actually buzz the interns or the volunteers after work and ask for money or whatever other help. It shouldn't be happening. So that's how we protect our interns and volunteers. So when that happened, we become the third person in between. So we have to contact the interns and then contact the mothers, and then we have to create the middle line, and then we need to observe and we need to monitor. It was very difficult, and the line keep cutting. And during the first MCO, I think we couldn't do our online classes very well. And that was very frustrated. And I also teach in a private tuition center. So what I did that I actually trying to try myself some activities online with my students. They have better internet connections. So I try to come up with Kahoot so that I can make more interesting for children to play the questions and how to share. And then I try to come up with, try to look into some applications app online that that kids can actually do offline without any pop-ups. So I had to do a lot try and error with my interns, you see. So that was very difficult. But after second and third MCO, I mean, like, we become much more, what's it called, prepared. So when everybody come back in June, I think 10 June, I think we came back, right? So that moment, the first week, we were like, okay, everybody, let's learn how to do online classes. So this is how the online class is going to be. Create everybody a Gmail account. Okay, so then because even at school, kids don't have a Gmail account, they can't even have Google Classroom. So a lot of kids will drop out even at school activity. They just don't know. Even taking photos, the kids take photos on the camera and it was very poor. They don't understand when I tell them take a clear photos. So when they came back, I told them let's do Google's Adobe Scanner. So we asked all the mothers to upload Adobe Scanner so they can take a good photo of their IC, the application for the Perhatin, the VPN, is it? The VPN. So like how to do everything. So sometimes they ask for the address, they just cannot take of good photos. So even all this thing we actually taught on the first week, we were preparing for the second wave. Like what if the second MCO comes suddenly in within a week or two, we cannot repeat the same thing happen at first. And some of mothers, we told them to apply for YTL, the free phone and a SIM card, but not all of them got it. And we actually raised fund online and also we asked donations. So we managed to get somehow almost 5 working PCs, few phones, and also some other materials that after the MCO, we distributed to family with a lot of children. So now all our children able to go for all the online classes. That's what I did.
Okay, thank you so much, Dr. Rabia, Okay, now we have one question here from Mr. Kent Chow. The question is, may I know anyone here has started the time banking system in your social work? So I open this to all three speakers. Thank you.
Perhaps explain a little bit what is time banking system, because I have no idea what that is. I'm so sorry.
Oh, okay. Can I talk something here?
Yeah,
Hi.
sure.
Oh,
Go
okay.
ahead.
Ken Chan here. I still off my video because this we call the time banking is I think is developed by those developed country. They encourage those people who have some time or free time during weekend and go for certain training and encourage them to work in those because welfare home we call community center so to earn the hours. So there are two systems. One thing is that they earn the hour. So sorry. Earn the hour so that they can redeem the hour when they need to use. And then the other terms, the term banking system, sorry, term banking is that not only apply to the social work because not many people good in social work. So that, however, for those technicians, mechanics, they also do community work to earn the hour, and then they can redeem the hour for other services. So but I don't know how to use it. So because in KK it's still very new. So I hope that in West Malaysia, some organization or some areas start using it. So that I want to learn how you can use such a system effectively. Okay, thank you.
Okay, thank you, Mr. Ken Chow. I open this to the speakers.
All right. Actually, what Mr. Ken Chow asking us actually, if we are doing like voluntary work, the time that we spend, can be put into the time banking system that we can at the end we want to use like point to be to buy some groceries, for example, or to passionate in terms of our bills, house bill, and so on. But in overseas, yes, Mr. Kanchao, at the moment, I don't know, MASW do never use that at the moment. I think back in 3 years ago, ISM, Social Malaysia, actually are looking into this initiative of time banking system to all the volunteers, Sukarawan Malaysia, something like that, with the JKM volunteers. But I'm not sure what's the status. Maybe if we have participants here from JKM or ISM, maybe can share a little bit about this system.
Or anyone else would like to share if they have any idea about time banking? I think the idea is alongside what Mr. Ken Chow and Dr. say.
Yeah, actually, we don't have time banking because usually volunteer they need to go through a thorough interview as we're working with children. So we need to go through interview, CPP agreement, and so on. So we don't simply take anybody as we are working with children. But we are using Sedunia platform. I'm not sure how many of you heard Sedunia platform. It's under Epic Initiative, and we every volunteer activity, especially on Sundays or forum, we usually give the link to the volunteer. The volunteer have to register themselves, and they will say that, okay, I would like to attend this particular sessions. I would like to come for volunteering or something. But it's only for those who already passed the interview. That's the only person actually can add on. So once they add, they have their own ID, so they know that how many volunteering activity they have done, not just with us, but it can be doing any volunteer work with any other associations that register under Sedunia, and they will get a points. I'm not sure how well they are being monitored or they get any award. I'm not sure about that, but it's something new.
Sorry, I would like to add on. I hope that after the end of this session, we have some authority or academician can look into this system and see how we can practice it in Malaysia. So come on, something more practical for us to follow. Is that okay for that? Thank you.
Thank you so much, Mr. Ken Chow from. Can I know your organization, please? Comfort Age, is that it?
Okay, I come from Kota Kinabalu. I studied gerontology 10 years ago. Now I work as I set up 2 senior homes, especially cater for dementia care. So I hope that there will be more youngster or whoever to encourage them to do more voluntary work whenever they are free, because we really need to cultivate such a culture. All right, and our population is aging, so we really need a lot of people to look into this field. All right, thank you.
Thank you so much, Mr. Ken Chow, for a very good suggestion on time banking. Do we have any other question from the floor? Anyone? I think what Mr. Ken Chow is suggesting just now, if we were to embark on that, I think if JKM or the government were to embark on that, we also, like what Dr. Rabia was saying, because we're dealing with vulnerable population, so any volunteers that we take on board needs to be screened first, and also probably provide some on-hand training. And then probably then we can use the system such as time banking, because without a background check, we worry that manipulation can happen to our vulnerable groups, especially if we're dealing with children and you know, old age and a lot more. So is there any more question from the floor? Can we have, I think we almost, yeah, we can have about 1 or 2 more questions from the floor before I hand over to Mr. Teo. Okay, that's one more question from FB Live. From Chiu, is it Mr. Chiu Yi Che? Okay, the question is, I have a question, which is like, if I have set my own rule, I know what my self-thinking ideas about some things to do, but I am not very good in showing people my boundaries. What suggestion of how I can do, of what I can do, or how I can do when people always step on or get into my boundaries? Maybe any one of the speakers would like to answer. Okay, from Mercy RGS to everyone, I think Mrs. Amy Bala wants to share to I think Mrs. Amy Bala, are you answering the question here, or you want to share about, maybe we should address this question first and then we can go to Mrs. Amy Bala.
Okay, if I can try to explain a bit about that, how we can actually avoid our boundaries being violated. First, we have to understand who actually come to our boundaries. Is it our close a person to us, or is someone who are outsiders? You know, if close, whatever family members, yeah. So that one that we can. Maybe we can make advice direct and explain, like what Dr. Rabia said, explain why we say no to our children. So we can explain to our family members as well. Right? But if it's someone from the outside, so we can actually not just ignore, but try to avoid a meeting or joining with him or her, you know, because we don't need more stressor during our process, actually during this MCO, yeah, because there's our boundaries. We set the boundaries and we have to set boundaries because the boundaries actually keep us safe, yeah. So that's for us very important. And how long can we set the boundaries? Maybe temporary or maybe a long time. So this is the thing that we need to explain. But if someone is a minor, like children and so on under our care, then I'm sure we have this power of parenting care. Yeah? so we can explain and give other example, role model to them. So keep us while they have to focus each other work. So that's be much easier. Right. That's all, Annie.
Okay, thank you so much, Dr. Sam, for explaining to us. I think Rabia is saying here, is boundary has to do with secondary trauma. I think, Dr. Rabia, are you asking, or are you?
I'm asking.
Okay, right. Does boundary has to do with secondary trauma? So shall I open this, or it can lead to compassion fatigue, like what Dr. Rabia was explaining early on. It can also, if not addressed among social workers or among professionals or us in helping profession, it can also lead to vicarious trauma, much bigger, whereby we feel really drained out and burnt out and the job is no longer enjoyable, I think. So, or if any one of us would like to address more. Okay, then do we have any question, Mrs. Amy Bala?
No, it's not a, sorry, it's not a question, but with reference to Mr. Kent's request on time banking system and social work, I know currently in Malaysia, we don't have bank for social work, but it exists for community work. A number of corporations actually encourage their employees to do community service. And this community service, their contribution, their involvement is taken into consideration, and they do give them points, like they give them extra leave. And I even know a university that does this. When the students go and do community service, they also get credit points. So in Malaysia, social work per se, not yet. But for community service, a number of them have considered this. And I do agree with our moderator. Screening will be extremely important before anybody is allowed into their premise or into their organization before they allow them to do any kind of community service. Thank you.
Thank you so much, Mrs. Amy. I think that really answers our question just now regarding time banking. So do we have any more questions from either from FB Live or from the floor? I think one last question before I hand over to Mr. Teo Aihua for the final wrap up. Any last question? Okay, so if there's no question, then I will hand over to my co-host, Mr. Teo Aihua, and thank you so much, everyone.
Okay, thank you, Dr. Annie. Thank you, all three panel speakers, for the wonderful presentations. Okay, we are coming towards the end of our webinar today, but before you go, there are a couple of things, that's going to take place. Okay, one is that I've just shared a Google form, that we would like you to fill up before you leave. Okay, we have two more things to go do before we close the webinar today. So okay, so now I would like to call upon Mrs. Amy Bala, Vice President of the Malaysian Association of Social Workers, to give words of thanks and also the closing remark. Amy.
Thank you, Teo. The host has blocked my video, so it's okay. I shall still speak. Thank you to the two frontliners who shared their heartfelt sharings during this crisis period, and both of them were very honest in their presentations, how they explained how they went through this crisis, how they were so reflective as a good social worker. They reflected and also they came out with alternatives. And Dr. Sam topped it all by giving all the tips where a person is able to cope. The self-care is so important. The me time is so important. But the underlying factor is reflective practice. And that's really, really important. I thank two of you. I also thank our efficient moderator who managed the time so well and also gave appropriate comments. Mr. Theo and the team, thank you so much. Without you, this would not have happened at all. Last but not least, can everybody also follow our FB, because we have posted tips for all social workers to manage efficiently, to be professional in their undertakings, in their case management, in their reaching out to their clients during times of crisis. So do go back to the FB and look at our tips which we have posted. Thank you very much, everybody. Thank you. See you again at the next webinar.
Thank you, Amy, for the closing remarks. Yeah, we're coming to the last thing, yeah, before we end today. I would like to kindly, okay, one is that for you to fill up the form before you leave. Secondly, is like we want to take a group photo, yeah. I think that has become a new norm when we do webinar, yeah. That everybody to switch on, we will ask everybody to switch on their video so that the technical team will be able to capture your sweet faces, yeah. Okay. Okay. I see a cat here, yeah. Mohamad Shari. Okay. Okay. Well, you know, we encourage everybody to switch on their video so that we'll be able to take a photo. Yeah, Yong or Tina, who is taking the photo? Or Laila? Yeah. Okay. Okay. Let me also do a screen. What do you call? Yeah. Screen capture. Yeah. Okay. Everybody smile. Let me go to the first page first. Yeah. Okay. Hold on. Okay. This is page 1 from my screen. Yeah. Okay. Okay, I'm going to screen number 2. Yeah. Okay, so everybody smile. Yeah. Going to take this photo. Yeah, wonderful. Okay. Okay. Then we are going to the last. I think the last page. Today we have over 70. Yeah, just now maximum was 73 people on our Zoom, and also on our FB Live there were between 25 to 30. Yeah, so we have about roughly 100 people joining us for the webinar today. Okay, I have already captured all the photos. Yeah, so thank you so much everybody for joining our webinar this morning. Yeah, so we are coming just 5 minutes before 12. Yeah? So I'm not going to delay you for your lunch. Yeah, thank you so much. I hope that you all have find this webinar useful. Yeah, so another reminder, yeah, fill up the form because we want to hear more from you, and we hope that we will be able to organize more webinar, yeah, that you know, that you can suggest, yeah, the topics. Yeah, so with that, okay, on behalf of the Malaysian Association of Social Workers, I would like to thank again all of you, yeah, the speakers, the moderator, and all the participants for joining this webinar. Yeah, so keep safe, take care, yeah, stay healthy. Okay, okay, bye-bye.
Bye.
Thank you.
Bye.
Thank you. Bye.
Thank you so much.
Please fill in the Google Docs.
Yeah, the Google form is in the chat. Yeah, so just fill up the form. Thank you. Yeah, if you want to chat now also can. Yeah, or you know, we are filling up the form. Okay, so if you want to ask question, you know, more informally, but you know, open to everybody, that's fine. Okay, I think this is a platform for us to do some networking as well. Yeah, I think it's quite interesting to hear from Mr. Ken Chow. Yeah, especially what he studied about gerontology. I think this is something that is going to be big. Yeah, coming to leading to our aging society. Yeah, by 2030. I think we would like to learn from you as well, Mr. Kent. Okay.
Is the form.
Okay, if you want to share your organization, you can also use the chat, yeah, just to the link to your organization, yeah, just to introduce to your organization, yeah.
Mr. Theo, we record our session online, right? Facebook just now.
I think Laila, yes.
Yeah, then we can
Yeah.
send a link to the members of MASW. At least they can, watch later when they are free.
Yeah. Okay.
Yeah. Maybe next webinar will be on the gerontology. Mr. Ken Chow can come in, gerontology social work, maybe we can highlight that. Right, for Amy?
Yeah, we will have to discuss that afterwards.
Yeah, yeah.
Thank you for your invitation.
Yeah, because
please send me a notice. Thank you.
Yeah, first one is on the children, remember, for Amy? Second one on the mental health, and the third one maybe we can go on the gerontology.